Okay. So now let me take you through how your course journey for next 9 months is going to be. Now, you will be onboarded onto a Medtrain platform, and how do we onboard you, and how is it going to be? That will be following this my lecture. So that technology part of it will be taken over by Medtrain team. So I'll be going through how your curriculum is going to be and how your journey is going to be. It's a 9 month course, and along with that, there will be a 18 online contact sessions. That will be a Zoom sessions. It will be there usually in the evening times, somewhere around 8 o'clock to 10 o'clock, and once in every 15 days. 3 days of in-person contact session, that is personal contact session, will be there most likely in the February. And it's very important to attend this personal contact session where we will be focusing on the core hands-on skills. And without the personal contact session, the eligibility for the writing the exam also will not be there. And finally, there will be an exit exams. So you'll be getting it across with 12 modules and 34 chapters. Approximately once in about 5 days to 6 days, one content will be released. And each content might be ranging somewhere between about 45 minutes to 1 hour or 1 hour, 10 minutes. So you need to spend at least minimum 3 hours in a week to do the good justice. You will require 1 hour to watch the course and probably about 15-20 minutes to do an assessment. After every chapter, there will be an assessment. Maybe 1.5 hour to read the chapter relevant to the textbook. And the more you read and more you spend on time on it, it is definitely worthful for you. But if at all anything less than 3 hours in a week, then you are not doing justice to the course, and possibility of you practicing an allergist will be less. So please carve out your time. I know that all of us are busy, but please carve out your time. 3 hours is minimum. The more you do, the better it is. You will be getting a textbook also as a part of the course. So that will be the second edition. That will be from Professor Vedantan sir and his team, allergy for clinicians. And you will also get a allergy test kit. Now, why we are doing so much is we want you to practice allergy. We want you to practice skin prick test. So you will also be getting a kit which is designed from us, which is most relevant to the to your practice. And all your previous batches who have done the case discussions or case presentations, 90 plus case presentation library, you have got it. So when you get an access, you get probably it is actually not 90 plus, it will have reached about 120 and odd. So you will get a access to 120 case discussions which are done by your previous alumni and the faculty. Now, this is an immense value for you. Say, if you have been asked to present a case on some food allergy or some allergic rhinitis, you can always go back and then see, look at how the case has been presented, how it has been discussed, what kind of a questions has been asked, so that you can prepare yourself in a much better way. Okay. We will be giving you an allergen calendar. This is again with lot of effort we have put it across. Of course, we got some of the contents from Merck. We have taken the permission also. So you'll be getting an allergen calendar which will specify about in an Indian scenario what kind of a pollens are common, which region, what is it called in regional language, which months it is predominantly present, what kind of a symptoms it present. So it has been uniquely designed for practice, and lots of documents like say skin prick test or a consent form or any of these documents we would be sharing with you. All you need to do is change the logo and just start practicing in your clinic. Now this kind of a so much of assistance is something which we are doing so that you actually practice allergy. You will be getting a calendar, monthly course calendar. In fact, for the next 9 months, when will be the Zoom sessions and what kind of a case discussion will happen and who will be presenting. Everything we will be sharing it to you much before. This is because we will be actively involving you, whether you want it or not. You need to present a case or you need to be a part of some kind of a discussion. There will be a lot of interactive situations or scenarios will be created. There'll be a lot of OSCE type questions will be there, lot of demonstrations will be there. So everybody has to get actively involved. There is no option there. We will also be putting a every Saturday, Sunday, we'll be putting a WhatsApp poll. We will be putting a we'll be putting a picture of a plant and asking you what is this plant and when is it the pollens are released, or some kind of a question like that. Or it can be some theoretical question, or it can be some clinical scenario when like a patient has appeared in the clinic and what would be your approach. So this is to keep tickling you and making you think about it, how to what would be your approach in that particular scenario. So the whole classroom will be divided into two sections, section A and section B. And the section A faculty will be managed by Dr. Sunila Nayak, Dr. Kiran Krishnamurthy, and Dr. Shruti Manjunath. Dr. Sunila Nayak is a pediatrician and an allergy asthma specialist, and she's got an immense experience, and she's been our faculty from probably the second batch onwards. And Dr. Kiran Krishnamurthy is a pulmonologist. So she's been also our faculty from last about 5, 6 batches. And Dr. Shruti Manjunath is an ENT specialist and allergy specialist. So all three of them have their basic training as well as an allergy training, and with a good teaching experience from the past. And section B will be from Dr. Nandana Bala. Nandana Bala is a pediatrician and an allergy asthma specialist. So she's been our faculty from the starting of our course. Dr. Spurti Reddy is again a pediatrician and allergy asthma specialist. She's been a faculty from long time. And Dr. Shruti Manjunath is an ENT specialist and allergy asthma specialist. So these faculty will be in charge of your course. However, we have worked it out in such a way that intermittently we will bring in different other faculties for a case presentation or for some kind of a discussion, so that you will get a different kind of an experience also. The online contact sessions, as I told, 18 OCS, Q&A and case presentations and spotters will be there, and revision classes will be there. The timetable will be shared in the group. For the A section, it will be like second and fourth Thursday, and the B section, it will be first and third Thursday of every month. And online contact session 50 every 15 days, and attendance is compulsory. Now there is a attendance also, we keep a watch on it. Less than about 85% of the attendance, we will not be even allowing for exams, sorry, 75%. And there will be a marks for every attendance. So the way the course has been structured is every person who is getting involved and doing an hard work will be compensated with a particular number of score or marks, which will be added to their final score. So please keep in mind that your assessment starts from day one, and it is not only in the final exams. And all the recorded version of the Zoom, the case presentation, whatever you do, will be available for you. That doesn't mean that you can skip the live session. The students for OCS, all students must be present, one case per, or a spotters or a journal club or anything. You will be using PPT as a mode of presentations, and PPT should reach the Medtrain team 4 days prior to the OCS. Say, for example, Thursday is going to be your OCS. We should get the PPT before Monday. Please don't try to make it a last minute issue, last minute trouble, because it's actually not only trouble for us, it will be a trouble for you too. So we need a PPT 4 days prior. And since we are going to give you a calendar of 9 months much before, you will have so much of adequate time. And please don't come in the last minute and then say that we need one more day and sending it 1 hour before the live session, which we will not encourage it also. So you need to be on time and pay attention to the mute and unmute, because it will be a open classroom. So we request you that you have enrolled for this course, and that means you have decided from your mind and heart that you want to learn this. And then don't do an half-hearted work. Don't practice. We have had a past experience. Somebody is practicing and then attending the Zoom session. So that doesn't make any sense. You're not justifying the patient. You're not justifying the course. Somebody is having a food. Somebody is like discussing something loudly. Please keep in mind that you are in a group, and we need to think of others also, and other faculty who have put a lot of time and energy to come there. So you will be using chat box for the questionnaires, and it will be compulsory to keep your video on. You can't switch off our video or anything. And the excuse of internet not working, all this not working, yes, we do understand that it can happen, but that will not happen repeatedly. And every month we will have an assessment for the chapters what you have learned it. Every second Sunday you will be given a test. There'll be two slots, morning or evening, and each test will be not more than about 20-25 questions. And if you have gone through the course, it should not take about 8 to 10 minutes to answer those questions. And we will not be giving other slots. And these marks will be added as an academic performance sheet. And more importantly, if somebody is not doing well, or whether they are doing well or not, you will be given a monthly progress and informing you where you're out doing well or where you're not doing well. And students who are not facing a challenges, you can reach out to the faculty by scheduling a prior appointment. We do understand that there can be some challenges, and if you have any major challenges, you can reach out to the faculty after informing the Medtrain team, and we will see what best we can assist you. In case if you're not doing well or not even reaching out to us, we will reach out to you. So that, please make sure that that should not happen here. Tentatively, it will be in February. Likely, we are not decided the date, likely between 10th or 20th, but we are not yet decided the date, somewhere around that. So maybe few months down the line, maybe 1 month down the line, we will be announcing the exact dates. It will be for 3 days and compulsory attendance. And this will be mostly for a practical part of it. The theoretical part, anyway, we would cover online. Since we will be giving you a skin prick test material during your personal contact session, we want the submission of 5 patient skin prick test as if you should have done it, and you should submit the skin prick test report form 1 month prior to the exit exam. Your theory exams will be for 100 marks, and all the exams will be on your online platform only. The way it is designed is every question opens up, and about based on the timing we set 60 seconds, 90 seconds, it logs out. So if you don't answer it, then you'll miss out on that. You will be trained anyway multiple times before we come to final exams. And your practical exams will have online, it will be an online kind with case discussion, clinical situations, spirometry or FOT or skin prick test discussion. So the practical contact session will be in Bangalore. And as I told, 75% attendance is required for online session, and timely submission of the assignments. So how will be your marks will be divided into theory exam 100 marks, practical exam 100 marks, and academic performance 100 marks, which includes course completion points, online contact session attendance, personal contact session, case presentation, assignment completion points, and monthly test points. So certification, we have already discussed it. So there is an advanced course also called Advanced Allergy, Asthma and Immunotherapy course. And for that particular course, you need to complete this course, then only you will be eligible. For all your doubts, clarification, you will be grouped into 2 WhatsApp groups. One is an academic WhatsApp groups for section A and section B, and one will be a technical group. So please don't mix up. Academic group used for an academic purpose, and where the faculty will be there, your other peer group will be there, will be participating actively, and our technical team will not be there. So if you say that, okay, I am not able to access some software issue, something into an academic group, nobody will help you out. So please make sure that you put the right question in the right place. And you'll have a technical group where your technical team will be there, and your technical team also can support you from morning 10 a.m. to 8 p.m. on all working days. So please understand that don't call them in the middle of the night, 11 o'clock, 12 o'clock, and then say that my app is not working or this. Expect that they are also humans. So, but we will be available from 10 a.m. to 8 p.m. and everything will be sorted out mostly immediately or instantly. But sometimes, if it is a major issue, it may take 1 or 2 hours. So as a student, you need to complete the course because every minute you spend on the app in the back end, we will be aware of it. We know that some student has watched the particular lecture some 20 times, 30 times because it was difficult for him. Okay, so you can even attend the multiple times assessment after each chapter also. So every minute you spend on the course, we will be aware of it. And online contact sessions, case presentations, monthly assessment, participate in the WhatsApp poll. Please don't think that, okay, I will answer the question after everybody answers. So that is meaningless because you are not learned it. If you're making a mistake, it doesn't matter because nobody is judging you at that point of time. So at the end of the day, the faculty or the somebody will answer the question, and so that it will be a learning experience for you. And in the personal contact session, you should be active and attentive. Assignment completion, clear your exit exams. So coming to the end of this, I would like to say that you have committed for this program, and we are committed to make sure that we train our best to make you a good allergy doctor, so that at the end of the day, your patients are benefited and you are benefited. So dedicate your time and energy, and I'm 100% sure that you will be satisfied and you will be at a different higher level after this course. Thank you.